This case is an example of this certification in an elderly patient. A 91-year-old nursing home resident with known prostate cancer recently had a fall with bleeding and has now died. You are asked to complete the death certificate. What is the most appropriate action? List prostate cancer as cause of death. List fall as accidental death. Write multiple contributing factors. Delay documentation. Refuse and refer to the coroner to investigate the cause of death. The correct answer is refuse and refer to the coroner to investigate the cause of death. Explanation: any death where a fall or injury may have contributed must be reported to the coroner, even in patients with known malignancy. Why the other options are incorrect? Writing prostate cancer alone may be inaccurate. You can't determine the cause without investigation. Doctors must not certify deaths that are potentially unnatural. You must not certify deaths that are potentially unnatural, caused by trauma or injury. So any death where a fall, trauma, or injury may have contributed must be reported to the coroner. I will show you a case with unwitnessed fall with MRI. No, with a CT scan is performed to investigate the cause of death. This is the case I mentioned. This is a CT scan of a patient with unwitnessed fall. This is another case. So let's start. This is axial and reformated coronal, axial and reformated coronal CT scan images of patient A demonstrate this. Mixed attenuation, subdural, because it is not convex, it is concave. Mixed attenuation, subdural haemorrhage, overlying the right cerebral hemisphere, the right cerebral hemisphere, with midline shift to the left, and subfalcine herniation. The midline here is shifted to the left with subfalcine herniation. There is subfalcine herniation. There is compression of the right lateral ventricle. The right lateral ventricle here is compressed. It's occluded here. There is compression of the right lateral ventricle and partial entrapment of the left lateral ventricle. So at the same side of the subdural hemorrhage, there is compression, ipsilateral compression of the right lateral ventricle and contralateral dilatation due to entrapment, contralateral dilatation of the left lateral ventricle. There is ipsilateral compression of the right lateral ventricle and ipsilateral dilatation of the left lateral ventricle. Next case, axial CT scan image in patient B, CT scan, and sagittal T1 weighted image showing subarachnoid hemorrhage, subdural hemorrhage within and overlying the left temporal lobe. So this is the left temporal lobe. There is subarachnoid hemorrhage and subdural. Subdural hemorrhage here means that the blood is within or outlining the left temporal lobe sulci, within the sulci. Okay, this means subdural hemorrhage. And here there is the blood here. Okay, concave with concavity. The hemorrhage here is concave. It's not convex. It's concave. So there is subdural and subarachnoid hemorrhage overlying. The subdural hemorrhage is overlying, and the subarachnoid hemorrhage is within the left temporal lobe. Subarachnoid hemorrhage within the interpeduncular fossa. As you know, this is the midbrain, and here these are the peduncles of the midbrain. Between the two cerebral peduncles of midbrain, there is the interpeduncular fossa. Okay? Between the two cerebral peduncles of the midbrain, the interpeduncular fossa. Blood is seen here. The hemorrhage in the interpeduncular fossa is considered subarachnoid hemorrhage because the interpeduncular fossa is a part of the basal cisterns. So, blood within the sulci is subarachnoid hemorrhage. Blood within the interpeduncular fossa is subarachnoid hemorrhage. Is considered subarachnoid hemorrhage. So here, there's subarachnoid hemorrhage within the interpeduncular fossa and overlying the right frontal lobe. This is the right frontal lobe. And as I mentioned, blood within the cerebral sulci. Can you see? This is considered subarachnoid hemorrhage. So there is subarachnoid hemorrhage overlying the right frontal lobe. Subarachnoid hemorrhage overlying the right frontal lobe within the sulci. Also, there is subdural hemorrhage along the falx and the interhemispheric fissure. This is the falx cerebri and the interhemispheric fissure. So when the blood is seen here, This is considered subdural hemorrhage. Why? The main difference between the extradural hemorrhage and the subdural hemorrhage is that the extradural hemorrhage does not cross the midline and does not extend along the falx cerebri. Okay? However, the subdural hemorrhage can extend along the falx cerebri and can cross the midline. So that when you see blood extending along the falx cerebri and within the interhemispheric fissure, this is subdural hemorrhage. So, subdural hemorrhage along the falx cerebri and the interhemispheric fissure. There is pneumocephalus. Can you see the pneumocephalus here? It's very obvious. Can you see the air foci here? When you see air foci within the brain tissue, this is called all of these are air foci. Okay, it's not within the brain tissue, it's seen along the cisterns. Sorry, it's seen along the sulci of the brain, sulci. Okay, this is called pneumocephalus. Pneumocephalus. There is also diffuse cerebral edema. This is the normal brain attenuation. This is the normal parenchyma attenuation. This is the diffuse cerebral edema of low attenuation. There is bilateral ankle herniation with effacement, with compression and effacement of the midbrain. So, as I mentioned, this is the midbrain. This is the two cerebral peduncles. It's compressed and effaced by, can you see this triangle here and this triangle here? This is the ankle herniation. Ankle herniation. Okay, why there's ankle herniation? It's mainly by the air and by the subdural hemorrhage. So there is bilateral ankle herniation that causes compression and effacement of the midbrain. So in any case of any case that had a fall with bleeding and after that has died, and if you are asked to complete the death certificate, the most appropriate action is to refuse to complete the death certificate and to refuse to list prostate cancer or falling or any contributing factor as the cause of this unusual or unnatural death. Don't list any cause or any factor as a cause of unnatural or unusual death, especially if this death is caused by falling or injury or trauma. Okay, so any death where a fall or injury or trauma have contributed, refuse to complete the death certificate and list any cause as and list any factor as a cause of death, and refer to the coroner to investigate for the cause of death, the exact cause of death.